Welcome to week 7 of learning the language of medications. And today we're going to be talking about infectious disease. Now, infectious disease is a lot. You can become a specialist in infectious disease pharmacy. So we're just dipping our toe in the water here. Now, when it comes to the naming of these drugs, there's a lot of good patterns in here that you can pick up on that can help you know which class a medication is. So let's get into it. These are our objectives. We're going to recognize the major antibiotic families, differentiate antibacterials from antivirals and antifungals. So if you see one of the medications, you would know which of those three that it is. Identify our common naming patterns, which I will talk about, and then looking at our different antibiotic combinations. So here are some of the classes that we're going to talk about. Don't try to memorize the medications just individually. Group them together first, and then within that group, you can learn the individual drugs. We have our penicillins, our cephalosporins, our fluoroquinolones, tetracyclines, macrolides, and then our antifungals and antivirals. We'll talk about those as well. First are our penicillins, and these are considered in a broader family of beta-lactam antibiotics, and that is based on their chemical structure. We'll learn more about that later. But these are our penicillins, and they work by inhibiting bacterial cell walls. So they can't hold their guts in, and so they fall apart. So we have penicillin, amoxicillin or amoxil. Then we have some combinations. We have amoxicillin clavulanate or augmentin, and piperacillin tazobactam or zosyn. So those combinations, that first word is the penicillin antibiotic, and the second word is those are beta-lactamase inhibitors, because basically what happened is we discovered penicillin, and over time the bacteria got smarter and developed an enzyme that broke down the penicillin so that they became resistant to those antibiotics. So what we have done is added a beta-lactamase inhibitor that stops the bacteria from being able to do that, and so that helps with antibacterial resistance. Next is the cephalosporins. These are also considered beta-lactam antibiotics, so they work in the same way roughly. These are very simple to remember what class they are because they all start with ceph. So we have cefazolin or Ancef, cephalexin or Keflex, cefuroxime or Ceftin, cefdinir or Omnicef, ceftriaxone or Rocephin, cefepime or Maxipime, and there's a few other ones that are not on the list, but they also start with ceph. So if you see ceph, it's a cephalosporin. Next, we have our carbapenems. Now, these also are considered beta-lactams. These have extremely broad spectrum coverage, which means they kill a lot of different kinds of bacteria. So we do tend to restrict these because of they're so broad. We want to protect them from resistance. And the two that you need to know are meropenem or merum, and then imipenem cilastatin or primaxin. And that cilastatin, that's another one of those beta-lactamase inhibitors. Next, we have our fluoroquinolones. These also follow a naming pattern. The two that you're going to learn on this list are ciprofloxacin or Cipro and levofloxacin or levofloxacin or Levaquin. And their broad mechanism is they inhibit bacterial DNA gyrase, which prevents the bacteria from being able to replicate. And then these are some other classes. So some of these medications, there are other medications in this class, but for your purposes, this is what you need to know. We have our macrolides, and that's azithromycin or Zithromax. That's also what a Z-Pak is. Then we have clarithromycin or Biaxin. Then we have our tetracyclines. We have doxycycline or Vibromycin and minocycline or Minosin. Then we have our lincosamide antibiotic, clindamycin or Cleocin. Next is our glycopeptide antibiotic, vancomycin or vancomycin. We tend to just call this vanc. So if you hear somebody talking about dosing their vanc, that's which one we're talking about. Then we have the oxidolidinone, which is linezolid or Zyvox. And then the aminoglycoside that you need to learn is gentamicin. And don't have to worry about the brand name for that. These are all very important. You're going to see them a lot in your education. Here's some other ones you need to know. These are all very important as well. They just don't fall into class groupings. So you can study the mechanisms and the classes and all of the other information about them in Fluent, and I encourage you to do that. But the ones we have here are metronidazole or Flagyl, nitrofurantoin or macrobid, also known as macrodantin. The difference is macrobid is taken twice a day with that BID, right? That's what that stands for. And macrodantin is 4 times a day. Then we have rifaximin or Xifaxin, fidaxomicin or Difficid, and then we have sulfamethoxazole, trimethoprim, or Bactrim. Sometimes you'll see that called SMZTMP. So those are the other antibiotics you need to know. Practice saying the words. It can be challenging to get those words in your mouth right. So practice saying them out loud until it becomes easy. Now let's talk about our antivirals. So a lot of times when you see cyclovir, we use these for herpes virus, whether it is we can use them for cold sores or other HPV type viral infections or others. We use them for shingles sometimes. So we have acyclovir or Zovirax and valacyclovir or Valtrex. And then we have our influenza virus treatments, oseltamivir or Tamiflu, and baloxavir or Zofluza. Now, those are easy to remember because their brand names all have flu in them. Also, if you'll notice, it's pretty simple to tell that they're antivirals. They all have VIR at the end, so they all end in vir. Next, we have our antiretrovirals, and there are more in-depth classes for these that you can learn in Fluent. But for now, just know that they are antiretrovirals that we use for HIV, PEP, and PrEP. So we have emtricitabine, tenofovir disoproxil, or Truvada. Then we have emtricitabine, tenofovir alafenamide, or Descovy. And those are 2 medication combos. And then we have our 3-drug combo, bictegravir, emtricitabine, tenofovir alafenamide, or Biktarvy. And the brand name is easier to remember for that one because it's bictegravir and Biktarvy. Then we have our antifungals, different fungal infections. Some of these are topical medications that we use for things like athlete's foot, but we also can use these for candida yeast infections, and those can be external, or you can have a severe fungal blood infection, and then those would be an IV. So we have fluconazole or diflucan, ketoconazole or Nizoral, and then clotrimazole betamethasone or Lotrazone. That is a combination of an antifungal with a steroid. And then our other ones, these nystatin or Nystop and terbinafine or Lamisil. Both of those can be used topical, or we have an oral version, just depending on what we're trying to treat. Then these are some anti-infectives or antibacterials that are topical. So we have chlorhexidine, and there's 2 versions of that. We have Paradex, which is an oral rinse that we could use maybe in dental surgery. And then Hibiclens is a topical that we would use for skin or wound cleaning. And then we have mupirocin. Oh, that's a typo. That's spelled wrong. Look at that. Mupirocin, it's MUPIROCIN. So make a note of that. And the brand name for that is Bactroban, and that is an ointment that we can use for wounds or MRSA infections. So these are some of the high yield naming patterns that I mentioned. If it starts with ceph, it's a cephalosporin. And if it ends in fluoxetine, it's a fluoroquinolone. If it ends in cyclovir, it's an antiviral. Again, we talked about bacteria. viruses, and fungi today. So you need to be able to see any of the medications I talked about and classify them as one of these three. Remember, when you're working on Fluent this week, focus on your pronunciation. These are some pretty complicated words, and the more you say them, the easier they get to say. And then learning your brand and generic names, our class recognition, and those naming patterns. So I know these are a lot of information, they always are, but try to slow down and spend time with them so that they get easier and easier the more time you work on this. And then here are our patterns. So this week you've seen one of the biggest advantages of learning pharmacology and treating it like a language, right? So a lot of infectious disease meds are full of recognizable patterns, and they help you identify their class before you know all of the details about it. So pay attention to that when you're working in Fluent. And as you're able to do that, you can spend more time becoming more fluent in your pharmacology, which is going to pay off in the future. So I'll say these again for you. We have our penicillins, cephalosporins, fluoroquinolones, macrolides, tetracyclines, antivirals, and antifungals. And then next week will be our last video where we'll be talking about some of the other classes that you might see in ambulatory care or in the community. So keep working hard. You're going to do great. I'll see you next week.